Janice, and I'm going to be your nurse for today. What's your name?
Navi.
Okay, and how old are you?
10.
Alrighty. I'm going to be doing a respiratory assessment on you, okay? That's why you're here. And the respiratory assessment involves me getting the inspection. So I'll be looking at your front and back, your anterior and posterior. I'm going to be palpating, so I'm going to be doing some touching and feeling. I'm going to be doing percussion, tapping, front and the back. And then I'm also going to auscultate with my stethoscope. I'm going to be listening. Is that okay? Alright. So, first I'm going to be looking at the anterior. And can you turn for me? Anterior and posterior. So the anterior, posterior to transverse diameter is 2 to 1. And so that's normal. I'm also going to be looking at the back. I'm inspecting. I'm making sure that the spinous is midline and the scapula is symmetrical. So it's even, it's not uneven, and I don't notice any lumps or any bumps. I'm also right now going to palpate for tenderness, okay? So let me know if you feel any tenderness. Any tenderness?
No.
Any tenderness?
No.
Any tenderness? And any tenderness. Alright, good. Now I'm going to do the tactile fremitus, and there's no tenderness to the posterior. I'm going to do tactile fremitus, listening for, I'm going to do the tactile fremitus to listen to the vibrations, okay? So I need you to say blue moon.
Blue moon.
Okay.
Blue moon.
Okay.
Blue moon.
Okay.
Blue moon.
Alrighty, so vibrations were felt while I was doing my tactile fremitus. Now I am going to do the symmetrical expansion. That's with me putting my hands right around T9, T10. So I'm putting my hands and probably my thumbs together. And I'm going to need you to breathe out for me. Okay, now breathe in. Breathe in. And then blow out. Okay, let's try it again. Let's breathe in and out. Okay, there. So the expansion was equal. Now I'm going to be doing the palpation, okay? And the palpation is with me touching and tapping, so I'm listening for sounds. I'm listening for sounds just to make sure that everything sounds normal. Okay. And then I'm trying to tap just not on your scapula and not on the spine, so like intercostal spaces. Alright, and posteriorly we have more of the upper lobe from the C7 to T3 to T4, and then from T4 on down we listening more to the lower lobe. So I'm going to auscultate for breath sounds just to make sure everything is clear. Alright. And you just take a little bit deep breath than usual. And if you get tired or wheezing, just let me know. Alright, just breathe normal. And lung sounds posteriorly were clear. So now, can I get you to turn this way for me? And I'm going to do the same thing like I did to the back. I'm just going to inspect and you'll turn this way. I'm going to do some inspection in the front interior part. I don't notice any accessory muscles being used to breathe, so you're breathing normally. I don't notice any dislocation or anything that's unequal. Respirations are 20. And now I am going to palpate for tenderness, okay? So just let me know if you feel any tenderness. My hands are here. Any tenderness?
No.
Okay. Any tenderness?
No, ma'am.
And any tenderness. Okay, very good. And then I'm going to ask you to say blue moon so that I can feel for vibrations.
Blue moon.
Okay.
Blue moon.
Okay. And
Blue moon.
okay. And so vibrations were equal. And now I'm going to palpate, okay? So I'll just do some tapping. And again, I'm focusing more in the intercostal space, so I'm not trying to tap on the ribs. I hope you could kind of see that. And that's kind of tapping on the accessory or axillary, mid-axillary side. So listen to the lungs of the right lung, lower and middle lungs is what we're listening for there, and the lower left lung. So since I palpated, do you have any questions? Okay. So now I'm also going to auscultate. So we did the tactile formitis, I did the palpation. So now I'm just going to listen to breath sounds and make sure that the lobes are nice and clear. And just like again, take a little deeper breath than usual. And if you get tired, just let me know. And anterior lung sounds are clear. Thank you. Okay, I'm giving a report on a 10-year-old female that came in for a respiratory assessment. Upon inspection, she was sitting in an upright, comfortable position. The spine was midline and the scapula was symmetrical both sides. I didn't notice any difficulty breathing or any unequal breath sounds or any body position. Everything was equal. The anterior posterior transverse diameter was 2 to 1. Palpations anterior and posteriorly were non-tender, and the tactile formitis was present. The vibrations were felt upon her saying blue moon. The symmetrical expansion was even and smooth posteriorly. The palpations of the lung fields were low, clear, and hollow. So low pitch, clear, and hollow, anterior and posteriorly. Upon auscultation, all lobes were clear for the lung sounds or the breath sounds. All lobes were clear bilaterally, anterior and posteriorly. Upon inspection of the anterior, no use of retraction or accessory muscles. The respiration were 20. Again, the anterior tactile formitis was present. The vibrations were felt and present, and there was no tenderness. Again, the palpations in the lung fields were present. They were low pitch, clear, and hollow. And again, the anterior breath sounds were present. That all lobes were clear bilaterally, anteriorly as well.